the next case. A 35-year-old female came with a history of increased pigmentation around the neck, bright reddish patches on the feet, ankles, and face, which increased on exposure to sunlight. She complained of recurrent diarrhea. On examination, she was disoriented. Her staple diet was jowar and maize for several years. The combined excretion of N-methyl nicotinamide and pyridine was less than 1.5 milligram in 24 hours. So now, looking at the findings in the case, we have the skin manifestation, that is dermatitis, which is seen on the feet, ankles, face and the neck, which again enhances on exposure to sunlight. She has the complaints of recurrent diarrhea. Again, her staple diet was jowar and maize, which is indicative of deficiency of the vitamin niacin. Hence, the probable diagnosis would be pellagra. Pellagra is a condition which is seen due to the deficiency of niacin, the water-soluble vitamin. Niacin is a water-soluble B-complex vitamin, that is B3, which is also known as nicotinic acid, nicotinamide, niacinamide, and also called the pellagra preventing factor of Goldberger. This plays an important role in energy releasing metabolic pathways and also has a role in DNA repair. The coenzyme forms of the niacin are NAD plus and the NADP plus. NAD plus is nothing but the nicotinamide adenine dinucleotide. NADP plus is nicotinamide adenine dinucleotide phosphate. So these two are the coenzyme forms of the niacin or the vitamin B3. Coming to the biochemical basis of the niacin. Now, the dietary sources of niacin are yeast, liver, legumes, meat. Now, we have seen the clinical findings in the particular case. And we know that the staple diet of the person is mainly jowar. So here, pellagra is in people in whose staple diet is jowar, that is sorghum. Though jowar contains tryptophan, what happens over here is it also contains large amount of leucine. Leucine inhibits the QPRT enzyme and hence niacin cannot be converted to NAD+. So pellagra is also seen in people whose staple diet is maize. In maize, niacin is present in bound form called the niacin, which is unavailable. Further, maize protein zein lacks the amino acid tryptophan, impairing the synthesis of the coenzymes of niacin, hence leading to deficiency of niacin. Now we know that this niacin has an important role in the energy releasing reactions. So it is required for the oxidation reduction reactions like citric acid cycle, glycolysis, cholesterol synthesis, etc. So pellagra mainly affects the skin, GI system and the central nervous system. This pellagra is characterized by, that is typical presentation of a case of pellagra is by 3 Ds, that is dermatitis, diarrhea and dementia. And the 4th D can be death if not treated and progresses in the same order. What is dermatitis? As in this case we have seen, dermatitis is the characteristic feature of pellagra which is similar to sunburns. There is bright red erythema and pigmented skin rash over the areas exposed to sunlight such as neck, ankles, back of the feet. There is bronzing and thickening of the skin. Sometimes skin rash occurs around the neck and is known as a castle's neck, which is typical of a case of pellagra. The skin lesions may worsen by the formation of vesicles and bullae. The 2nd D is the diarrhea. Deficiency of niacin causes inflammation of the entire GI tract, leading to loose stools and diarrhea with blood and mucus, which may lead to weight loss. There is associated nausea and the vomiting, and also glossitis can be seen in this case. The third one being the dementia. In acute pellagra, delirium is the commonest mental disturbance seen. In chronic pellagra, dementia is frequently seen. In mild cases, there is irritability, poor memory, and inability to concentrate. In severe cases, there is posterolateral tract degeneration, ataxia, spasticity, involvement of bladder and rectal sphincter, depression, and also depressive psychosis. So, how do you treat this case? Niacin is given in doses ranging from 40 to 250 milligram per day orally on TID in 3 divided dose in a day. So, this is about the case of pellagra, which is due to the deficiency of niacin, the coenzymes being the NAD plus and the NADP plus, and mainly presents with the symptoms of dermatitis, diarrhea, and the dementia.